So just wait for my cue. I will give the cue. After that, you can go. Yeah, right now. Please go ahead.
Okay, thank you. Thank you so much for this great opportunity. Welcome to PG Track CSI Delhi branch program again. We are coming back after quite some time now. And it has been due to a lot of encouragement, lot of mails and lot of, your words that have encouraged us to restart this particular program. Though we understand that COVID is still not much of great concern to all of us, but it is very important for all of us to have this online learning with best of the teachers. And today we are starting with 102nd webinar, the clinical pulse, the unique PG track program. I must also introduce our new secretary of Delhi CSI, Professor Girish MP, who has recently become the secretary, and our president, Colonel CP Roy, who will be joining us soon. We have a great privilege. We really humbly request to our most respected Dr. Anita Saxena, ma'am, who has been our mentor and has taken a lot of fantastic sessions earlier. And ma'am is currently working as Vice Chancellor in BD Sharma University of Health Sciences. She's one of the stalwarts. You talk about congenital heart disease, rheumatic fever, rheumatic heart disease. Everywhere, ma'am is, just a who's who name in this particular field. So, ma'am, it's truly a privilege for us, an honor for all of us and many of our students, more than 150, 200 students live now, to listen to you. They were so excited writing to us again, asking for the links. And it's such a privilege to have you, ma'am, on this wonderful program. Ma'am will be speaking on approach to cyanotic congenital heart disease. Ma'am, over to you, please.
Thank you very much. I would like to begin by thanking Dr. Mohit specifically and your whole team, and of course Intas, for starting this initiative. And if I remember correctly, I was perhaps the first speaker in your previous
Yes, ma'am.
version
Very well,
also.
very well, ma'am. It started off with you.
Right. So I'm glad to be back, and I think you will, all of you, the students, will perhaps benefit by the talk that we are going to give today. So the topic that is something that Dr. Mohit wanted me to talk about is approach to cyanotic congenital heart disease. And I would hopefully finish in 40 to 50 minutes at best. And we'll be very happy to take some questions because it will really make it more interesting if there are comments and questions. So I would encourage all the participants to maybe write questions in the chat box or something, whatever the arrangement is, but it will be good to have some discussion towards the end. And I would like to thank Dr. Roy, Dr. Girish MP, and of course, Dr. Mohit again for being on the panel. So this is something that's going to be all age groups. I'm not just going to talk about neonates or infants, but I would try to address some of the issues of adults with cyanotic heart disease, which all of you do see from time to time. So when we say cyanotic heart disease, we generally mean that the child is or the patient is blue or cyanosed, and obviously we're talking of central cyanosis. But we also must remember that cyanosis could be because of pulmonary origin, and all these so-called COPD patients may be somewhat hypoxic. But what we are going to talk about is cardiac cyanosis. And of course, then child may look blue because of some hemoglobinopathies, which again we will skip for today. To differentiate pulmonary from cardiac, which is usually not a problem in older children and adults, but yes, sometimes that's a problem in small babies, we like to do hyperoxia test, and I'm sure you all are aware of it. So when we see a cyanotic child at any age, be it an infant, neonate, or adult, there are a few things that we have to do, and going systematically always helps. And that's why we are speaking today on approach to cyanotic heart disease, because all of you know that echocardiography can give us a lot of information, but unless it is supplemented, supported, complemented by history examination and X-ray ECG, the tripod of physical examination or of clinical cardiology, I think we will be making wrong diagnosis most of the time.